Good afternoon, and welcome to the June Simon Says Expert Series. I'm Mary Robertson. I'm with the Cancer Center's Office of Community Outreach and Engagement. Our office aims to reduce cancer by providing a two-way link between our researchers and the community with a focus on underserved populations. I oversee the Prevention and Screening Branch, which engages community partners to develop and implement cancer prevention and screening programs throughout the entire state. We focus on areas like today's topic, preventing skin cancer by protecting our skin from the sun and UV rays. Our expert today is Dr. William Wooden. Dr. Wooden, the James E. Bennett Professor of Plastic Surgery at the IU School of Medicine and the IU Simon Comprehensive Cancer Center, specializes in skin cancer and melanoma. He also specializes in pediatric reconstruction surgery and head and neck reconstruction and microsurgery. Dr. Wooden is actively engaged in clinical care as well as academic teaching, mentoring, research, and program management. Thank you, Dr. Wooden, for joining us today.
My pleasure. Thank you, everyone, for joining us today, and I appreciate the Cancer Center's team making these events available to the public. If you ever have any questions, please reach out and contact us. So again, I'm Dr. Wooden, and I'm going to try and keep this at a high level. I'm going to try and keep medical terms only to the fun ones that will kind of say, what do you mean? But I'll explain everything as we go forward. Next. So one of the reasons that we want to bring skin cancer to you and make sure that you're aware of it is skin cancer affects all of us. Now, those of us with lighter skin and family history certainly have a higher risk of skin cancer, but all of us, even our very dark complected families and patients, are at risk for developing skin cancer. Your skin is your biggest organ of your body, and it is exposed to the entire world and protects us every day. We have made great advances in many areas of cancer, lung cancer, colon cancer, breast cancer, and others. But skin cancer, unfortunately, the rate of skin cancer continues to climb. And so this is where education to you as our public, as our friends, as our colleagues, is really important because skin cancer is, for the most part, preventable. And we want to turn this curve around to where it goes down instead of up. Next. So why is skin cancer becoming more prevalent? Well, our society has changed. If you think back to our great-great-grandparents and before, they really did not show as much as their bodies as we do today. And so we enjoy lighter clothing, less clothing, and we do a lot of outside activities. Instead of farming with log clothes on and things of that nature, we get to go to the beach and things like that. Unfortunately, that puts our skin at a great deal of exposure. And in my lifetime, and when I was a child, my dad was Navy. I grew up on Navy bases on the water. We hadn't even invented sunscreen yet. You then got zinc oxide, the white pasty stuff that looked like a whitewashed fence. And then we had pre-sun and things of that nature, which were chemical sunscreens, which are almost as vicious as the sunburn themselves. So a lot of these things are effects of our society today. And the key thing is, how do we help educate you to protect yourself? Next. So some other interesting experiments in life is if you look where different populations have migrated. And so Australia was populated by Northern Europeans in England, and the indigenous population had a great deal of native and natural protection due to their dark skin. We all have the same number of melanocytes. So no matter if you're very pale or if you're very dark, we all have the same number of cells, but over time, our bodies adapt to our environment. And that's how we get dark skin complexions. The closer you are to the equator, the heavier your sun exposure, your darker your skin will naturally become. Very light people will tan, but that's only short-lived. Usually wind up getting a great deal of risk exposure. But if we look at like Australia, they have an exceedingly high risk incidence of skin cancer because we transplanted Europeans, and they really represent that rest. The native indigenous populations, Aborigines, have a very low rate, but it's still there. Next. So remember that your skin is there to protect us from everything. There are some things that you can do. So just be aware, protect your skin, use shade, use sunscreen, make sure you avoid tanning beds because we don't want to get those ugly sunburns that you see on Facebook all the time. We're also exposed to not only the effects of the ultraviolet radiation from the sun, but also chemicals in our environment. Our environment has changed. Your skin is durable and it heals, but it pays the price over time. And so the key thing is we need to ask you to take better care of your skin, and most importantly, takes better care of the skin of our children, our grandchildren, and the generations to come. If we can prevent our kids and our grandkids from ever having the sunburns that we had, we can dramatically reduce the risk of skin cancer. Next. So skin cancer, it comes in lots of different flavors and varieties, and these are a little gross, but they're what we have. And so the key thing is we want to make sure that you understand how you can get the medical resources so that we can treat your cancer as early as we can. All of us are at risk. Those of us with lighter skin are going to be at higher risk, and those that have a family history are going to have a higher risk. How do we prevent it? The key thing is really understanding what causes it. It's the ultraviolet light and the chemicals in our environment. So the key thing is protect yourself. For sun, shade, wear a hat, sunglasses, take an umbrella, wear sunscreen. Sunscreen is now plentiful, relatively inexpensive, although that world is changing. But Walmart, Kmart, CVS, the dollar store all has it. Pick a variety that you like and that you use, and then really use it all the time. The key thing is you got to put it on heavy, you got to put it on before you expose, and you got to re-expose. The other next thing is be vigilant. When you get a spot that doesn't heal up, our bodies are supposed to heal. So if you get a new spot on your skin that grows or doesn't heal, that's got to be a real warning sign to you. That's a red flag to go see your doctor so we can get it diagnosed early and get you the best treatment and outcome. Next. So risk factors, we're coming back to the sun, and we talk about UVA and UVB and UVC. That's the sun's radiation. When you watch the weather forecast in the morning on the news, they will often list you a UV index. That's telling you how much radiation we expect from the sun with the sunlight to actually get to us. And it'll actually say it's a rating of 1 or 2 versus 8 or 9. Lately, in this past weekend, it was a 9, which means you could get a sunburn if you're light-skinned in less than 30 minutes being outside. So remember, if you are light-skinned, you're at higher risk. If you're ethnically light-skinned, you're at more risk. But please, for all of you out there that do have darker, warmer skin complexions, unfortunately, you are at risk as well. So likewise, if you get a spot that looks weird, strange, wasn't there before, doesn't heal, come find your doctor. Ask us early. Don't hide it under Band-Aids, and go from there. There are also some other medical indications and sometimes some medicines your doctor may put you on that then make you at risk for sunburns. So tetracycline is one that's common. It's an antibiotic. We often use it. So your doctor and your pharmacist should help you understand that if you get medicines that then make you prone to sunburn, be extra cautious about avoiding the sun, wearing sunscreen, and have your doctor and your pharmacist help you understand that. Next. So again, chemical exposures in family history and medical history, there are a lot of things that you can do to just recognize those dangers. So if you work in a chemical plant or the chemicals, they have the big labels on there. Read them and get your supervisor and things to help you understand the risk and the appropriate protections. If you have exposures, get the appropriate treatment, and again, protect yourself. Your medical history. As we get older, we are not as durable as we used to be. And so there are medical conditions and medicines that you may have to be on that, again, predispose you to developing of cancers. Skin cancer is very common in our patients that have to be immunosuppressed or are immunosuppressed. So if you have an illness that suppresses your immune system, where you have to go on medicines like transplant medicines or rheumatoid arthritis medicines that suppress your immune system, you can be at an increased risk for developing skin cancer. So please talk to your doctor and then make plans with your doctor to help to check for that. So the key thing there, see your dermatologist, see your treating physician on a regular basis. Diet and prevention. I get a lot of questions about this. The key thing it comes down to is a good diet. Okay, I know that sounds silly, but if you think about what we eat on a regular day, we often take the shortcut, processed foods, less fruits and vegetables, less fiber. Actually, all those are critically important, and you will feel better, your body will work better, and you will have less cancer if you make sure you eat a good, well-balanced diet. No skipping meals, 3 meals a day, 3 simple meals a day. Okay, avoid the real concentrated sugars and sweets and processed foods, and you'll find out you save money and feel better. Prevention, especially with skin cancer. Hats, sunscreen, they actually have sun-protected clothing now. It'll have a little SPF lighting on it. And those are all important ways to do it, and see your doctor. Don't let things grow without us getting a check for you. Next. So with good treatment, we can decrease how severe and how skin cancer affects you. We've actually been able to reduce death rates from cancer with good and early treatment. And this is why we want to bring this message to you today, and the other messages we bring from the Simon Cancer Center is we're here to help you get the best results and help you with any of your problems in the realm of cancer. So these are very important things. Remember, is the changes we're talking about can actually save your life. Next. So when we talk about phenotype, what is phenotype? That's your skin. So there are people like me, and then there are people that are equatorial that have very dark skins. Again, we all have the same number of melanocytes that make tan, make skin color. Those equatorial populations just have them turned on. So those of us that came from Northern European and Northern climates, John Starks of the world in the snowy mountain covered up in furs, we never needed much sun protection or much native color because we never saw the skin. And so your skin actually makes important things like vitamin D. So it was actually helping us take advantage of the sunlight to make your vitamin D. We'll talk more about that in a minute. So red, blonde hair, brunettes with light hair, light eyes, those are going to be our patients that are at most risk. Freckling can be an issue as well. So our lighter skin patients are far more at risk. And when we migrate to sunny areas and don't wear much clothes except the bathing suit and some sunglasses, you can see why we get skin cancer. Next. There are also some genetic things. And so unfortunately in Indiana, we do see people with unusual genetic diseases. One that we see commonly is dysplastic nevus. That's where you have lots of bad molds. A dysplastic nevus is a mole that is precancerous. So if you have lots of molds, it's really important to identify those early with your doctor, get seen by the dermatologist, and get followed very closely. There are also some other more unusual things, and these are diseases that unfortunately get diagnosed very early, but likewise, we can put you at risk for skin cancer. So if you have any questions, just ask your doctor. If your doctor hasn't gone over that with you, just ask them. That's what we're here for, is to help you understand your disease, your medicines, and the things that we can do to help you. Next. Again, as you get sun exposed, your skin gets sun damage. So if you look at our young people, they have nice, pretty skin, but you start looking at grandparents, our skin gets wrinkly, our skin gets older, and it gets a lot harder to then, there we go. We see your body has a harder time recovering and repairing from that damage. So one of the other things your dermatologist and your doctor will talk about is actinic keratosis. That's just sun damage. Unfortunately, that will be a potential precursor to cancer. And so we need to watch that and monitor that. So as you start getting the little scaly spots, the little wrinkly spots, the little brown spots, that's a warning sign for us that we need to take better care of our skin than we did before and see our dermatologists and doctors more often to make sure you don't develop a cancer. And if you do, treat it as early as we can. When it's small, it's generally really easy to treat, and I'm not that evil. Next. So there are some other conditions like exposure to it in the old days, arsenicals. So in the old days of farming, I grew up in North Carolina, and even here in Indiana, you'll talk to your grandparents, and where they used to have a donkey that went down the rows of crops, and they would actually pat the bags of pesticide, which were often arsenic, which was great at killing bugs, not very good for anything else. But exposure to that really can then be a risk for many diseases, including skin cancer. Exposure to ionizing radiation. So if you work in an area where you use those types of things, that can be an issue. Human papillomavirus increases the risk of squamous cell skin cancer. Some of the viral agents and things can likewise do it. Sun damage, actinic damage, certainly is one of our biggest risks we see that brings on skin cancer. Next. Immunosuppressions. I talked about this a little bit, just a little bit ago, but I really want to emphasize this. So if you are an organ transplant patient, or if you are on medications to reduce your immune response to things like psoriasis, rheumatoid arthritis, scleroderma, lupus, those can increase your risk of skin cancer. So please talk to your doctor about that. Make sure they get you connected with a dermatologist to be followed. Also, if you've had another cancer, that stress of that cancer or major surgery or injury or things of that nature suppresses your immune system, and unfortunately can lead to skin cancer and other problems. So if you have those things, Think about it. Our patients with HIV, that directly attacks your immune system. We've gotten far better about treating that than in years past, but it still is one of those risk factors. So if you have something like that, we want to make sure that you work closely with your doctor to then connect you with our Simon Cancer Center resources to help take the best care of you as we can. Next. In this kind of a little list of other things that, diseases that can result in immunosuppression, I think I've talked on most of them, but just a list that kind of help prompt your memory that if you have something, ask your doctor, I'm at risk. The key thing then is being more vigilant with sunscreen and protecting yourself with clothing and shade that you bring with you, your umbrella. Next. So this is just some fun little science. So you think of our skin, and that little picture is kind of a picture of your skin. It keeps the gooey stuff on the inside and the good things inside and the bad things outside. But the radiation that we're talking about, the ultraviolet radiation, actually penetrates your skin. And it then can affect the cells of your skin and affect your immune system. So it gives you a double whammy. The radiation harms your DNA, harms the cells, and it actually suppresses your immune system, which makes it easier for a cancer to grow. That's about as deep as I'm going to go on the science. Next. Here's another little picture of it, which again just reinforces it. The key thing we want to do is we want to protect you from that radiation to begin with. We want to block that with sunscreen, with shirts, with shade. Stay out of the sun in the middle of the day. Go out in the morning and evening when it's not as bright so you don't have these problems. Next. So if we just look at history, if you've had a cancer and a prior cancer, then unfortunately you got a pretty good chance of having another one. So this kind of like the first warning sign. My generation, we didn't have sunscreen. I've already had mine, and I see my dermatologist on a regular basis. We find things when we're little, we can freeze them, burn them, scrape them off, and avoid having new problems. But again, if you have a spot that changes in color, it doesn't have to be pigmented. It can be kind of pinky, fleshy, but if it's new, if it's sore, if it grows, if it bleeds, get it checked. That's what we're here for. We're here to help you. Next. Things that are good. I talked about diet a little bit ago, but really your vegetables and your fruits and a good balanced lean meal is great. So you want to have your good, and right now all the farmers markets are opening up. You got the roadside stands, so you got your tomatoes, you've got your squashes, you've got your nice fresh lettuce, cucumbers, all those wonderful things that are high in vitamins, high in fiber, both of which are really, really important. Staying healthy, being a little bit lighter than I am. I'm working on that every day. There's some data that even an aspirin a day can be helpful, but only take that if your doctor recommends it. Next. You really want to block the sun from getting to your skin. So again, a hat, an umbrella, sunscreen. We talk about UVA and UVB. So you'll want to buy a sunscreen that tells you it blocks those. And they've gotten really a lot better than they used to be. They used to hide that stuff on the back of the label. Now it's right up on front. Everyone always wants to know, do I have to buy a 100 or a 75? The reality is a 15 to 30 is all you really need. And I'm going to emphasize that next little bullet. If we get our kids on sunscreen early in life, we can reduce their lifelong risk of skin cancer and melanoma by almost 80%. A good diet in fruits and vegetables. So get your 15 to 30 sunscreen. If the other ones are on sale for the same price or less, sure, buy them. But you don't have to pay extra money for extra number because it really doesn't help. The key thing is apply it thickly, early, before you go out and get all hot and sweaty, and reapply on a regular basis. Next. So again, how do we monitor? We've got great resources here at IU, not only downtown, but across our system. We've got the Simon Cancer Center, and we have all our affiliate facilities that we're developing across the state. We've got a new facility going in at Fort Wayne in the north. We've got a new facility in Bloomington. We're working to expand our resources at North to expand our expertise for you. So your doctor, and most importantly, you are one of the most important assets in identifying cancer. When you feel bad, when you see something new, when something changes, reach out to your doctor, reach out to us. There are some great websites out there. The federal government actually runs the National Cancer Institute. We can argue all the good things, bad things, but this is one of the great things they do. It's cancer.gov. You can read about all the different cancers, including skin cancer. There's some other ones. The Skin Cancer Foundation, the Run for the Sun, they have a great program here in Indiana. Natural Cancer Institute, lots of them. And we have great cancer center great department of surgery, and a great department of dermatology that will help you, as well as many, many, many of the community providers, which can provide excellent support and access for you. Next. So again, looking at the NCI website, this is a great, and I really, if you do have cancer or have family members that have cancer, this is a great resource. If you go to the Simon Cancer Center, many of our links will bring you back to this, because this really is a great place to easy to read information and education. Knowledge is power. We want you powerful over your cancer to defeat it. So reach out to us, take a look at the websites, and we're here for you. Next. So staying healthy, and there's a lot of questions, I've been emphasizing this, but the key thing, shade, clothes, a big hat, big silly sunglasses that protect ultraviolet. You only need a 15 to 30 sunscreen. There's lots of them out there. Find a variety for you. You don't need to live in a hole. You don't have to grow mushrooms in a cave. Just be smart. Avoid the sun in the middle of the day and protect yourself. Next. Checking. Everywhere. Yep, everywhere. Sorry, everywhere. For those of you that do your nails, watch under your fingernails. You can actually get cancers under your fingernails and under your toenails. So if you get a black spot, that's not because you dropped a hammer on it or tripped over the dog, you need to get that checked. So I'm not wearing any nail polish or anything today, so I can see mine. Most of those things are from things on the farm. But for those of you that do get your nails done, whenever you change your acrylics, whenever you change your nail polish, if you see a new spot, then get it checked. Check the bottom of your feet, check between toes, use a mirror, have someone else look for you. All our phones now have great cameras on them. So it's really easy to have, a friend, a family member, take a picture of the back of your back, the back of your legs. So then you can compare month to month to see if things change. And if things change, what do? We find our doctor. Next. We always talk about normal to abnormal. Okay, and so the top row is representations of relatively normal things. But I want to point one thing out. We talk about the ABCs, asymmetry, the borders, the color, the diameter, and is it evolving? Is it changing? So, the one on the top is a pink little thing. Melanomas can be amelanotic or not black. So if that pink thing grows, changes, or evolves, if it falls into the ABCs, then we're going to want to check that, just like we want to check one of those yucky ones at the bottom. Next. So again, watch yourself. If you see something, if a family member points things out, please come find us. Your primary care doctor can help you to a degree. They can get you to a dermatologist. We have fun little tools, a magnifying glass, the little cute little thing called a dermoscope, which helps the dermatologist really look at the cellular level of your skin to help decide what needs to come off and what doesn't. We cannot take off every mole, and we should not take off every mole. But if it meets those ABCDEs, then we need to really think about taking it off. Next. Okay, so where can you get help? You can get help from your skin cancer provider, somebody like myself, but a lot of the times it's just your good primary care doctor. When? Please, early. Don't hide things. If things change, if things get irritated, like we're just talking about, don't hide it under a Band-Aid. Come. Get us to check it, get your family doctor to check it, get your dermatologist to check it. We have broken healthcare in the world today, and especially in the US and here in Indiana, it's hard. COVID has wreaked havoc with us. The environment has wreaked havoc with it. The economy has wreaked havoc with it. So act early. And I know it's hard to get in, but be persistent, and we'll do our best to help you. And really, you want to get checked several times a year. That's really, really important. If it doesn't look right, come find us. Next. Okay, what do we do when you have something? Okay, we're going to want a piece of it to send to the laboratory. Do not dread that. It's really simple. It's even simpler than going to the dentist. I know you may not like your dentist, but they're important. So it's really easy for us to numb up a little spot, take a little piece, and send that off to the laboratory. That's the best way to actually diagnose if you have a cancer or not. There's a couple of ways you can do that. But so just be prepared for that. If you've got a spot, we want to take it off. We're going to want to send it to the lab and then get you the results so that we can take care of you. But don't dread it. It's really quite easy. And we've gotten quite good at it. We actually are very, very kind. We're not mad scientists. We're not going to be mean to you. Promise. Next. So, especially in melanoma, once we get your pathology back, Your provider will go over with it. He'll talk about what the pathologist found, what type of cancer it is, if it's a melanoma, how thick it is. And with that, then staging. Staging comes with a combination of the pathologic diagnosis, what we found from the laboratory, your examination, and then other testing we would do, chest x-rays, lab works, and some other things. And that will determine what we may have to do. In melanomas, we may have to be more aggressive than just a squamous cell or a basal cell, because melanoma, unfortunately, can try and spread to the body through the lymphatic system and the lymph nodes. And we've really got great technology that helps us do that for you to really take the best of care as possible. Next. So staging is one thing you always want to know about. The simplest stage is a 0. I have it, but it's really not an issue. That would be the stage 0. And then it advances from there up to a stage 4, to where then we have to really think about more aggressive treatments. But hopefully you'll never have to understand this, but we do have a process that's very understandable, and we'll go over it if you need it, but hopefully you won't. Next. So what are the treatments? How do we actually treat it? The first is the diagnosis. And then for the next part, we want to get rid of the cancer. Sometimes your dermatologist or primary care doctor can freeze it, burn it, scrape it. If not, then it comes to surgery because we want to take it out. Sometimes that's a little surgery, some that's a bigger surgery. But the key thing is we want to get all the cancer out. That's what we call margins. You want to get all the cancer out. And depending on the cancer, then we might check your lymph nodes. Basically, that's the first couple steps. Diagnose it, take it out, and based on those findings, then we may recommend other exercises like CT scans or PET scans or things of that nature to really help direct your cancer, monitor it, and help monitor whatever therapy we think is best for you. Next. So sometimes we have to do bigger surgery where we want to take it out. And depending how big it is, we may have to do other things, but then we will do our best to do a reconstruction. That's a lot of what I do as a plastic surgeon, is getting you back together so that you then can camouflage the cancer as best as we can in the results of the surgery and treat the cancer all at the same time. Next. So again, these are the size of the surgery depends on the thickness of the tumor. If it's a real thin one like the in situ, then it's a small one, and then it gradually gets bigger, but we never do more than 2 centimeters, which is just under 2/3 of an inch. There's 2.54 centimeters per inch, so just a little over half an inch around the whole tumor, and then get things back together for you. Next. Sometimes we will do a sentinel node. A lot of people want to know, do we have to do that? Should I do it? A sentinel node is testing the node that goes with your tumor. Each part of your body goes to a different lymph node. That lymph node's job is to filter out cancers that try and spread, just like they filter out bacteria and viruses when we get sick. But we can identify that with some special x-rays. And the question is, when do we do it? Most of the time, we recommend definitely when it's over 1 millimeter. If it's a thin lesion of 0.75 to 1, and that's talking about the thickness under the microscope, then we'll talk about it. The key thing is work with your doctor. Your doctor will walk you through it and explain when we do recommend, when we don't recommend, and why. But these are the tools that we have to help identify how far your cancer has spread and identify how we can do it. We now have great new drugs that treat melanoma and really do a great job with it. If you need it, you only need it if it's a spread. So this is a real important tool to help us identify if your cancer has tried to spread, and you will benefit from the new therapies. Next. So these are some of the x-rays we'll get, and some of the data goes with it. The key thing is that if we can identify that it's spread, then we know that you're at high risk for having trouble. This is where the new immunotherapies come into play. You hear a lot on the TV about genetic testing this or immunotherapy that. It's real. It's not fake news. And the great news is these drugs work. They really do improve survival. They can be very well tolerated, and we can use them over a broad spectrum of our population, from very young to very old. And so we really do have great tools to help improve your survival if you need them. But the key is, let's get an early diagnosis so we can avoid all this to begin with. Next. So this is just some pictures of sentinel. We put a little blue dye in. There's already been a little nuclear tracer, and we take out the blue radioactive lymph node, which we then send to the laboratory. Next. So again, we do an injection with a little tracer, and we do an injection with blue. And again, we take out the blue thing. It really makes things pretty easy for you as a patient. And for us, we generally do this under general anesthetic at the same time we're treating your primary tumor. But again, don't dread these things, and we'll do our best to walk you through exactly how it works and how it really does benefit you. Next. So again, the key things when you have a cancer, we're going to want to do some basic examination, the biopsy. We're going to want to do some basic testing, and from that, we'll give you an idea of where we need to go from there. Then the next thing is usually a surgery to take out the tumor with clear margins. It may or may not benefit from a sentinel node. And based on those results, we'll go from there. If you've had a skin cancer, you will always need your dermatologist, and you will need to see them frequently. For a melanoma, you will see them 4 times a year forever. I apologize. Yes, 4 times a year forever. From a surgery standpoint, you generally get to divorce me fairly quickly. I do take rejection well, but the key thing is your surgeon will work with you up until you're done and you're well healed. If you have a risk for developing future cancer or recurrence, then they may include an oncologist with you and your dermatologist. This is where the Simon Cancer Center comes in. We really build the entire cancer center cancer program about building the multidisciplinary team so that we can try and give you as much one-stop shop as you need. So you'll get your oncologist, you get your medical doctors, you get your surgical doctors, and then we try and link you across the state so that you can try and keep as much of that close to home as possible, but expand the expertise of the High-U health system so that you have it at home working with your doctors. Next. So where it's talking about drugs, the new drugs, if you have melanoma that spreads, the new drugs actually do work and increase survival. We've got a long way to go to get perfect and get better, but literally these drugs are new in the last 5 to 7 years, and they are showing incredible promise over the years when I was a younger doctor. These things really have shown great promise, and we're getting new ones every day. And so I'm very excited that for our skin cancer patients today, we've always had good surgery. We've gotten better surgery. We've got more precise surgery. We've been able to limit the brutal surgeries we used to do in years past to more refined surgery. And now we have great drugs to go along with it. Next. So the immunotherapies are real. They're stimulating your body's own immune system to help fight your cancer, getting your immune system to kill your cancer, and figuring out how we best destroy your cancer. I have a great job. I can talk about killing things. I hate cancer. Nobody likes cancer. We need better tools to help your doctor. And one of the great tools that the Cancer Center has invested in is now a body scanner that we hope to have operational by this fall, where you'll be able to go in and get a 3D image of your body to have to map your moles, mole mapping, and being able to track and follow your moles over time to help your dermatology, especially if you're someone who's had multiple cancer, has multiple moles. So this will hopefully be available later for your doctor and you this fall, and it'll be a really great addition to the Simon Cancer Center and High-U Health Network. Next. This is a picture of it. You actually step into this great machine, and it's not quite Star Trek, but it's pretty close. And it takes a body of every piece of visible skin that you have. And then it helps use some artificial intelligence to help your doctor identify which ones may or may not need to be biopsied and which ones need to be watched. So these are some of the great tools that we have within the Simon Cancer Center to help you and your providers. And hopefully this has helped give you a better understanding of skin cancer and how we might help you. So I think this is the end, and we're happy to take some questions.
Yes, thank you so much, Dr. Wood. And I know you packed a lot of good information in there, and I know I learned a new thing. So thanks for being here today. But we do have several questions that were submitted. So I know you talked a lot about people with a history of cancer, skin cancer, and how often they should get screened. But we have a question about if you have no history of any skin issues, how often should you be checked by a dermatologist?
Yeah, so this is where really working with your family doctor helps, because we don't have as many dermatologists as we need. So if you really don't need a dermatologist, then let's not complicate your life and save those appointments further. So start with your family doctor. If you have a heavy history of sunburns and you have skin spots, then yeah, we need to get you to the dermatologist. And then your family doctor may feel comfortable doing some of the screening and some of the biopsies. But if you otherwise have taken very good care of your skin, you have beautiful skin. So if you've got great, beautiful skin and you've been wearing your sunscreen, then you can start with your family doctor. And that way you can kind of tier the expertise that you need. It's kind of like cardiologists. Do we all need to see a cardiologist? Well, not until your blood pressure gets out of whack or you start having troubles. But your family doctor can really be that great portal to help you, help educate you, get you information. But if you've got a spot and it's changed, then either the family doctor needs to biopsy and get you to a dermatologist, or get you to a dermatologist and get you biopsy.
Wonderful, thank you. Our next question is, if you want to walk outdoors for an hour, when is the best time to do it to avoid those harmful rays you spoke about?
Right. So watch your morning weather forecast. Your weather forecaster, I'm a Channel 59 guy because I kind of like them. And the weather forecast comes on the perfect time right before I walk out the door. But they'll give you the UV index. The UV index is always at the peak of the time. So literally between 10 and 2 or 3, that's the peak sun. So get out in the morning. It's much pleasant. The birds are out, they're chirping, everybody's happy. The sun is low on the horizon, so you're going to have less exposure to dangerous rays. So a nice walk in the morning as the sun starts getting up and it starts getting hot, that's a great time for a siesta. Okay, different societies, I love a siesta, except I never get a siesta. Would love to have a siesta. And then as the sun gets down to the horizon of the sunset, likewise, is further away, the sun has to pass through more of the atmosphere, which filters out ultraviolet. So morning and evening, those are the nicest times you got. If you do have to be out in the middle of the day, that's the only time you get out. Wear your sunscreen, wear your hat, put on your sunglasses, and wear your sun protective clothing. For many of us that work outside, we have a lot of people, farmers, our construction teams, our linemen. Many of us have to be out and about, or even if your car, even if you're just going to the grocery store, you get ultraviolet light coming through your windows, your arms out the door. So remember, daily wear sunscreen is important for all of us. Put it on in the morning. If you're out and active, reapply it. But remember that daily wear sunscreen. For those of us that wear makeup and use lotion, you can get all of your makeups with and without sunscreen. So as you run out, replace with the same thing, but with sunscreen in it. If you like lotion, just buy a lotion that has sunscreen in it. Remember, you only need a 15 or a 30, don't pay extra for more. If it's the same price or cheaper, yeah, sure, take it. 15 to 30 is all you need. I don't wear a lot of makeup, but I keep sunscreen everywhere. It's in my bathroom. It's on my back porch. It's next to my lawnmower. It's next to my tractor. So I don't have an excuse, although I feel sometimes because I'm human. And I get yelled at by my wife and my patients because I come in a little red. And again, I always pick on them when they get red. So, really just make it part of your life. So avoid the sun if you can. If you've got to be out, protect yourself.
Thank you so much. Our next question is it true that most of your skin damage happens before you're 30? This particular person that submitted this question, the melanoma runs in their family and they're diligent about sunscreen with their children, but what should they look for on their own skin? Are there early signs of skin cancer? So I think you covered the latter half in your presentation.
Yes, but just remember those ABCDEs, okay? Asymmetric borders, changing color, bigger than a pencil eraser, and evolving, growing, itching, bleeding. And yes, that's why I really, 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 really want to emphasize protect our children. Make sunscreen and skin protection just as important as seat belts, bike helmets, and life jackets. Those are basic. You saw this. We can reduce a child's risk of skin cancer by almost 80% by getting them to use sunscreen and never letting them get those sunburns that many of us got as kids. So they make great products. They make colored ones. So you can make them in little purple monsters and green monsters and yellow monsters. So the key thing is you learn that you don't miss a spot. Coat them up before they go out. So you can still go on vacation. You can still go to the beach. You can still go to the park. Just coat them up before they head out. Let it dry. And then if they're playing an active soccer game or something like that, get them to reapply. When they stop, for halftime, or they're stopping water, the offense, the defense is coming on, get the kids to reapply. Work with the coaches, set up shade for the bench. A lot of really basic things where we can do a better job of, so that we don't put our kids through the same things that we did. It really does make a difference. Let's try.
Absolutely. Our next question is, how long does it take for cancer to appear after exposure to too much UV rays?
Everybody's a little bit different. For those patients, I'm going to take somebody like an albino, someone who has no pigmentation genetically in their skin. They can have skin cancers all the time. They can pop up every minute. You can see them, take them all off, and at the next visit, they got another one. Oh my God, it's just miserable for them. For most of us, there's a latency period. So that's why you get your burns as a kid, And then you start seeing your skin cancers in your 30s, 40s, and 50s. So there's generally a latency period of a decade or two in there. But again, it depends on your medical history, the intensity of the radiation, and were there any other chemicals and things of that nature involved. In our veteran population, we've got some, unfortunately, real examples of that. So many are shipwreck survivors from World War II and Korea. They got exposed. When a ship goes down, they're out in the sun, they can't put on sunscreen, and they're floating in diesel oil. Those patients really had a problem. Then we had Vietnam, Agent Orange. And so that creates a whole nother. So depending on your history, you may be at higher risk than others. So if you've had an event, again, make sure your doctor knows about that event. But most importantly, for most of us, just be very diligent. And that's where the picture, yes, look everywhere. Yes, look everywhere. Get somebody to look at your back, take a picture of your back, the back of your legs. I frequently have patients that tell me, oh yeah, my daughter or my wife or somebody pointed that out when I was on vacation last year, and I never got around to it. And now, Houston, we have a problem. So the key thing is be vigilant, be diligent, take care of each other. Your family, your friends can be good advocates to help. Hey, does this look right? No. Then what do? You get rid of it.
Absolutely. I think we just have a couple more questions. This one, I think you alluded to, with getting into an appointment with your dermatologist or your primary care provider. But this person asked, that can be often delayed months at a time or several weeks. So what is the preferred action if they notice a suspicious mole or a spot on their skin, but there's a long wait time to get in with their doctor?
Be diligent. Okay, I'm going to give you an example myself. I need to see my primary care doctor. They gave me an appointment in September, and it's like, let's see if we can't move that up. Okay, I know what's wrong, so let's just fix this. So yeah, be diligent. For a routine check, an appointment 3 to 4 months out from now. Okay, if it's a routine check, that's fine. But if you've got a spot of suspicion, be your best advocate. Say, listen, Dr. Wooden, I've got a spot that I'm really concerned is cancer. It's growing, it's ugly, and it's itching, and it's oozing, and it's bleeding. I got to put a Band-Aid on it. And what the answer should be, we'll get you worked in. Somebody will get you worked in. If not, call another provider. The world is broken. It breaks my heart when I walk through the hallways and I see empty beds because we don't have nurses or staff to do it. And I see it in the faces of our doctors. We're stretched incredibly thin. You were not able to do what we want to. We had trouble before COVID. We didn't have enough healthcare providers before COVID. COVID has then decimated us. So we got to work together. But if you have a real high suspicion, just emphasize that to your doctor. And then we'll figure out how to work it in. And if you need to, say, hey, is there another office I can call? We all respect that. We shouldn't get offended at that. I have my limitations just like everybody else does. So just be an advocate for yourself. If you have trouble, give us a call and we will do our best. But I can tell you, we're as short as everybody, but we're working really hard. We've added Bloomington, we're adding Lafayette. We've got that. We're recruiting as fast as we can everywhere we can. So I think we're trying, and let's work together to make it happen.
Wonderful. Well, thank you so much. Those are all the questions that we had submitted. And again, I think you gave a plethora of good information, Dr. Wynn. So thank you so much for being here today. We really appreciate it.
You are very, very welcome. And everyone stay safe and put on your sunscreen.
Yes, thank you everyone for joining us today. And you can visit cancer.iu.edu/Simon Says for more info about next month's presentation. Thank you.
Excellent. Take care.